Hey guys, it's Bear. It's Friday, October 9th, and this is my most recent post-op video. I did a video about a month ago about being on T for 10 months, and in that video I said that I'd be getting to a top surgery update sometime later on this week, and like I said, that was like 3 or 4 weeks ago. So, just life is busy. It's really difficult for me to sometimes get to these videos, especially this setup that I've got going on here, so that I can actually see what I'm recording. It's just a little bit more of a hassle to set up. So, sorry that I've been kind of MIA and haven't done an update in a while. So that being said, it's, like I said, it's October 9th, and my surgery was June 9th. So if you look at it that way, it's been 4 months since my surgery. If you actually count the weeks, it's been 18 weeks, which means it's been 4.5 months since my surgery. But at this point, like I usually do, after you count weeks for a certain amount of time, I just kind of give up and I start counting months. So, whatever. 4 months post-op, 4.5 months post-op, 18 weeks post-op, whatever. The other reason I haven't done a video as recently is because there hasn't been that much to talk about, except for one complication, which I'll get to. That complication did make it just kind of a bummer actually to get online and talk about my surgery. So, that's the other reason that I haven't done it. So, in general, the healing from my surgery is really, really good. I'm really, really happy with the results. I've joked a lot about it, but basically I come home and my shirt comes off, and I'm just super happy to be able to do that finally. I was like 7 or 8 years old when my parents kind of started enforcing, you have to put a shirt on to hang around the house or to go outside and play. And so it's been, 27 or so years since then that I'm now making up for that lost time, and just being able to hang around the house without a shirt on. Unfortunately now it's fall and it's starting to get a little cold, and it's, I'm like, oh, I have to keep my shirt on, what a bummer. But fortunately, testosterone makes you really hot, so I'm actually much more comfortable than I used to be, just in a t-shirt anyway. So I'm still pretty comfortable hanging around the house without a shirt. So my chest looks good. It feels good. The incisions are healing really, really well. The right side here, you almost through a t-shirt can't even feel it. It's almost like smooth, with the exception of the little dog ear that I've got going on. That's gone down quite a bit. It's much, much more smooth. The surgeon may or may not even, touch that up, and he said it would be a simple office procedure. The nodule to the midline of both is pretty much gone. The left side is just a little bit slower to heal in general. That nodule on the midline's still there a little bit, but barely. I mean, we're talking just the very tip there. That incision is a little bit rougher. You can still feel some texture underneath of the scar tissue, and there's a little bit of a keloid going on in certain spots. But in general, both incisions feel really good. Very little tenderness left above and below, or if you press right on them. And like I said, the texture that you used to be able to feel is almost completely gone on both sides. The sensation around the whole area is a lot different than it used to be. It was numb for a long, long time, and especially the light touch sensation was really weird. And that's almost all completely normalized at this point. Deep touch is normal. There's still actually some tenderness under the armpit area where there was some liposuction done, and I'm told that that's really normal and it'll settle in time, and it's settled a lot. The light touch sensation is almost completely back, except for just on the actual nipple itself because of how that's grafted on. Deep touch I can feel everywhere, like I said. Occasionally I'll have an itch and I'll scratch it, and that's a little bit of an odd sensation still, where you're like, I'm scratching, but I'm not sure how much pressure to put on. And, like I said, everybody's individual with that. Some people get normal sensation back, some people don't. But I feel pretty confident with my sensation. And I'm just, like I said, really happy with the results. I have had a complication, and that's part of the reason that I didn't get on and do a video, because the complication just sort of, it slowed down my returning to normal activity, and it got me really bummed out for the last month or so. So I didn't want to get online and talk about it, and what happened is the left nipple, or areola rather, has kind of like a bump going on here, and it had a couple of sutures around the edge of it that had to be removed at my 12-week post-op appointment, and those were causing me a fair amount of discomfort around the whole area. The whole area was stinging really badly, just to light touch, and they're dissolvable sutures that had been addressed previously, okay, those will dissolve, or they'll fall out, or you'll be able to pick it out, with just tweezers or whatever, and that didn't happen. So at 12 weeks, the one was really embedded and had to be dug out. The one was pretty easy to pull out. And this bump over on the side, they've been saying that's probably the same thing, and just to let it be, and it'll probably work itself out, it'll probably dissolve, and it hasn't. And that, probably about 4 weeks ago now, started to cause just a lot of pain around that side and underneath here. It's a hard pain to describe. It's kind of like a stinging sensation, and it's very superficial. It's really on the surface layer. But when I called to complain about it and say, what do I do about this? It's been there since 4 or 5 weeks. We've been leaving it be, and now it's starting to cause me pain. The assistant told me, same thing. We were probably a suture, probably take care of itself. Let's just wait and see. But the fact that it was causing me irritation was a little bit of a concern to her, and so she told me that I was probably irritating the area with my physical activity, my martial arts training, jiu-jitsu. You're in contact a lot, and especially with your chest. And so she told me that probably I was irritating the area more by doing that activity, and that they wanted me to lay off of that. And so I did, and that's the point where I just got kind of bummed out. There's two things that kind of were bumming me out. One was, when you're in pain, when you're healing, it's hard to imagine when that's going to go away. And you imagine, this is the rest of my life. The rest of my life I'm going to feel this way, I'm going to be in this pain, and it's going to inhibit me from doing what I want to do with my life and what I want to do with my sports and stuff. And the other thing was that it was stopping me from doing the thing that I really enjoy doing. Martial arts is really important to me for a lot of reasons that I won't get into this, on this video. But it just got me really bummed out to have this kind of complication, and to have to kind of put things that are, training to the side. So I waited about 3 weeks after that conversation, and I finally called back and said, I've done very little physical training. I've just done things that are completely non-contact, and nothing has changed. And so I think it's time to get aggressive, or at least come in and see my surgeon. I went in on Tuesday, and my surgeon just said, look, it's irritating you, but you have a high pain tolerance. Can you handle the irritation? The answer is yes, because he didn't want to open up the area and dig around for something that may or may not be there. It may be a suture, it may be something else that's going on. It could be like a cyst or an abscess. Either which way, he didn't want to open it up at this point, and cause a possible infection, which is dangerous for grafts. And so I'm still playing the wait and see game. But at that point, I mentioned the fact that the assistant told me to back off of my training, and he said that was bad advice. and that I could go ahead and continue to pursue my normal activity with just some precautionary stuff. You can probably see that the skin around the area is a little bit irritated from wearing a Band-Aid every time. For a little while I was actually just wearing that daily because light touch was so irritating to the area. But when I train, I've been covering it and keeping it really moist, just as a precautionary thing. And he cleared me for that. He said, go ahead and go back to doing your normal thing. Pay attention to the area. If anything changes, give us a call. So that's where things are at. I don't know, again, when I'll do another update. Change has really slowed. The healing is really normal. So I don't know when I'll be back doing another update, but that's what's going on. It's really good. I'm really, really happy with the results. And I think that the healing really is going normally, even with this little complication. I think that there's a lot worse complications that you could have. So I'm very satisfied. I'm very happy that I chose to do it. I'm very happy with the doctor. And that's where things are at. So thanks for being patient with me, guys, and waiting for this update. Today marks 11 months since I've been on testosterone, so I'll have a year update coming up soon, and you probably won't see me until then. So thanks a lot, guys, and I'll see you next time.